Welcome to Psychiatric Mental Health Mini number 11, Least Restrictive Practice. Least restrictive practice is providing the least invasive interventions to reach the most effectiveness in treatment. It can be based either on the healthcare setting that the patient's receiving care in, or it could be based on the care provided. We always want to start with the least restrictive setting or intervention and evaluate for effectiveness. If it is not effective, then we can progress to interventions or settings that are considered more restrictive or invasive. Least restrictive environment is treating our patient in the least restrictive setting possible. So here is a pyramid from the World Health Organization that outlines the restrictiveness of different environments. For example, if someone has depression, or no, let's not say depression, let's say anxiety. We want them to practice self-care first and to try different things like coping mechanism, implementing exercise, changes to their medication, things like that. They're treating themselves in their home setting. If that's not effective, then we can move them up to primary care services and outpatient services. If outpatient services aren't effective, then we can move them to like a partial program where they're receiving treatments in groups that they would receive in the inpatient setting, but they're able to go home at the end of the day. If that's not effective and they continue to show symptoms of distress and have symptoms where it may impact their safety or other safety, then we can move them to an inpatient setting. Voluntary admission is going to be less restrictive than involuntary admission. And then lastly, the most restrictive setting would be things like long-term stay facilities, forensic centers, and group homes. We can also apply this to the care we provide to our patients. We always want to start off with self-care. If that's not effective, then we can implement different therapeutic communications and non-pharmacological therapies. If that's not effective, we can implement pharmacologic therapies. And if a patient's starting to get agitated or maybe considered a risk for their own safety or others, then the next step up, if that pharmacologic therapy is ineffective, is to use chemical restraints. If chemical restraints are ineffective, then therapeutic hold would be the next restrictive, and the most restrictive would be restraint and seclusion. And that wraps up our mental health mini on least restrictive care.